Go ahead, sir.
Hello, good evening, friends. Today, this is our last session of freedom from infertility, and today we are going to talk about freedom from recurrent IVF failures. Friends, infertility is a problem which is quite rampant these days, and 1 in 6 couple in India is facing this problem. And therefore, on the 75th anniversary of our independence, may we pledge to reduce or eradicate infertility from India. And that's why this attempt from Oasis Fertility to organize Freedom from Infertility campaign in this month of August. This is our fifth session, which is on freedom from recurrent IVF failures. So, friends, we'll see why IVF fails. Basically, the success of IVF depends upon three important factors. One is the embryo, second is the endometrium, and third is the environment in the uterus and the body. So we'll come to the first cause, that is the embryo. The embryo is made up from the egg and the sperm. So any defect or any abnormality with the egg and sperm can lead to a poor quality embryo and therefore can result in IVF failures. Secondly, the endometrium is an important factor. The thickness of endometrium should be uh, average between 8 to 12 millimeters. The thickness which is less than 7 millimeters is going to decrease your success rates of IVF. Along with that, the pattern of endometrium, the vascularity of the endometrium, and the receptivity of the endometrium, all these factors are also important when it comes to endometrium. Thirdly, the environment. So the uterine environment needs to be good. So there should not be any fibroids, adenomyosis, which is causing ill effects on the embryo. Also, the pelvic problems such as endometriosis, hydrosalpinx, etc., can cause decrease in IVF success rates. Now, friends, we need to see how we can improve the success rates in recurrent IVF failures. So, first, we come to the embryological factors. So, if there is a problem in the egg and the sperm, and resultant embryo is not good, then we need to improve the egg and sperm quality by giving certain medications such as antioxidants. We can improve the egg quality by changing the protocol for stimulation. We can improve the egg quality by giving certain recombinant injections. So, changing the type of injections can also help in some cases. So regarding sperm quality, if the sperms are issue, we need to check if there's any problem with the DNA fragmentation index. If there is any problem, then we can employ sperm selection techniques for doing IVF or ICSI. And these techniques are magnetic assorted cell sorting, PIXI, microfluidics, IMSI, and so on. So all these are options are available for us, along with use of antioxidants in both improving the egg and the sperm quality. So once we are sure that the embryo quality is of a good grade, which is seen with the eyes, this is called as morphological assessment of the embryo. So does only morphological assessment help? So sometimes we can miss out certain factors on just seeing the embryo. So an alternative to this is assessment of the embryo using pre-implantation genetic testing, and this can be done by embryo biopsy. So if there are recurrent IVF failures, we can we can select a good embryo by doing a pre-implantation genetic testing either by embryo biopsy or a non-invasive pre-implantation genetic testing by using the cultured media of the blastocyst, which can help us without even taking the biopsy. We can see which embryo is good and which embryo is bad. Regarding the other factors, so we can also analyze the embryo based on artificial intelligence. This option is also available. So embryo assessment is very, very important. Then sometimes there can be genetic defects in the parents. So there can be translocations, inversions which can be present, and this can be transmitted in the embryo. So again, the pre-implantation genetic testing for structural rearrangements is very, very helpful for such patients. So we can have this easily available at Oasis Fertility. Then we have the endometrium. So endometrial assessment is routinely done by using a transvaginal sonography and a Doppler to assess the blood flow. But when this pattern of endometrium is not good or the thickness is not good, we need to improve and optimize it and then go ahead. So for optimizing the endometrium, we can do something called an endometrial scratch or office hysteroscopy or a metroplasty or estrogen therapies, GCSF. We can also use PRP or stem cell therapy to improve the very thin endometrium cases. Along with that, sometimes the patient may have very good endometrium lining and very good vascularity, but in spite of that, the embryo is not able to attach, and this there can be a problem with the receptivity. So the receptivity, if it is poor, the embryo will not attach and it will not grow. So this receptivity can be checked by doing a test called as endometrial receptivity array, and this endometrial receptivity array tells us the exact time of embryo transfer for that patient. This is called as personalized embryo transfer or PET, which is helpful to improve the success rate, optimize the success rate in patients. The third important factor and how we can improve is the uterine environment. So if there is presence of any fibroids, we need to go for myomectomy or downregulation. If there is presence of adenomyosis, most of the cases, downregulation with GnRH agonist, letrozole, or Mirena, that is the progesterone IUD, can help to increase our success rates and decrease the rates of adenomyosis. Sometimes the adenomyosis is extensive and we might need a surgery, that is a wedge resection of the adenomyoma in some certain cases. So this can also be helpful in certain patients. Uh, Along with that, pelvic problems can be pose a problem for the success rates of IVF. So if there is presence of endometriosis, we need to operate the patient or we need to downregulate the patients by giving GnRH analogs. If there is presence of hydrosulfing, we need to clip the tubes or remove the tubes. That is, sulfingectomy can be done, and the success rates of IVF can be improved. Other factors is the environment of the body, and sometimes the body rejects the embryo, so there is an immunological mechanism of rejection of the embryo, and this has also to be taken care of when it comes to recurrent IVF failure. So we can use certain treatments such as immunological therapies, intravenous immunoglobulins, intralipids, lymphocyte immune therapy, and so on, to optimize our success rates of IVF. Along with that, treatment of thrombophilia forms an important treatment in patients of recurrent IV failure. So we can give low molecular weight heparin along with low dose aspirin for such kind of patients. Uh, Sometimes the uh, integrins, which are the basic implantation molecules, can be at a lower level in such patients where a recurrent IV failures are seen. Therefore, a PRP or a peripheral blood mononuclear cell therapy on the day of starting progesterone can be helpful for such some patients where there is a recurrent IVF failure. So, friends, the problem of recurrent IVF failures is very enigmatic. We cannot uh, diagnose the cause immediately in some patients. Some patients we have unexplained recurrent IVF failures, and therefore the treatment becomes a difficult part. But with a proper patient approach, with a proper diagnostic techniques, we may be able to come to conclusion what is the problem, and then we can treat it accordingly. Also, are the options available which are higher end options and which are available in very few fertility centers. So Oasis Fertility offers these treatments like the pre-implantation genetic testing, the ERA, then we have the PRPs, the peripheral blood mononuclear cells, sperm selection techniques, and a variety of other baskets which can improve the success rates of IVF in many of the patients. So to end friends, I would like to state here that we have lots of patients of IVF failures coming to us, and therefore uh, my core specialty is to study and research on IVF failures and find solutions to the problems of these patients. And certainly, we have been instrumental in giving babies to those patients of recurrent IVF failures uh, who had lost hope and were not hoping to conceive uh, through any form of treatment. But yes, we have been instrumental. We have been helpful to such couples to achieve their dream of parenthood. So thank you for your patient hearing. If any questions, I would like to take that. How do you stay positive during fertility treatment is the first question. So basically, it's a very important aspect to stay positive, because we have so many negativity when the duration of infertility is large, when the IUI fails or IVF fails, the negativity starts to creep in. So we have to concentrate on a good diet plan, a good sleep pattern, and a good exercise pattern to remain fit and to remain mentally less stressful. We can also adopt meditation techniques and so on. Also, help of the fertility specialist can be taken. We have special counselors who are dedicated to counsel you regarding the role of positivity and stress freeness, which is helpful to get a very good success in IVF. Next question is, can emotions affect fertility? Too much stress, too much anxiety definitely can cause impairment of your hormones, and this can cause decreased ovulation at times, affect your semen analysis reports, and therefore the final outcome, that is having a pregnancy, can be a problem. So there, yes, emotions can affect your fertility. How can I de-stress to get pregnant? I think we have answered this question, how to get stress free. Fertility specialists at Oasis Fertility are ready to help you in this aspect as well. You can meet us or call us on our helpline numbers, or you can meet us to have mm, proper fertility care with it in a stress free situation. uh, yeah, I think this is a related question. We can go to the next question if there is any. So I think we are done with our questions. Thank you so much. For any query related to infertility, and if you want the freedom from infertility, please contact Oasis Fertility on the below given helpline number. Also, you can reach out to any of our centers physically. We are located in Pune at Wakad and Kharadi centers, and you can visit any of our centers for any fertility related query or treatment. Thank you so much. Thank you for your patient hearing.